America's obesity crisis appears more unstoppable than ever. A troubling new report released Friday by the Centers for Disease Control and Prevention shows that almost 40% of American adults and nearly 20% of adolescents are obese, the highest rates ever recorded for the U.S. "It's difficult to be optimistic at this point," said Dr. Frank Hu, chair of the Department of Nutrition at the Harvard School of Public Health. The trend of obesity has been steadily increasing in both children and adults despite many public health efforts to improve nutrition and physical activity. The continued weight increase in youngest Americans is especially worrisome for long-term health. 1 in 5 adolescents, ages 12-19, 1 in 5 kids, ages 6-11, and 1 in 10 preschoolers, ages 2-5 are considered obese, not just overweight. Obesity is medically defined as having a body mass index of more than 30. The findings on obese kids in the U.S. comes on top of this week's World Health Organization report that childhood obesity is soaring around the world, increasing more than tenfold over the past 4 decades. Overweight and obese children have a higher risk to stay obese, and childhood obesity is linked to a higher chance of early death in adulthood. Overall, 70.7% of Americans are either overweight or obese, meaning that an unhealthy weight has become the norm, with normal weight Americans, a BMI of less than 25, now in the minority. What the CDC report doesn't reveal is why the obesity crisis continues to worsen. A recent study by epidemiologists at Georgia Southern University discovered that fewer Americans, particularly women, are trying to lose weight. Public health experts say that an unhealthy diet and a lack of exercise are still the 2 biggest culprits. There's still a huge amount of cheap, accessible, highly processed food available everywhere almost any time, says Hu. And despite people doing more recreational activity these days, the overall activity level, household activity and occupational activity has decreased in recent years. In addition to unhealthy foods and a sedentary lifestyle, there could be another possible reason for the increasing obesity rate: sleep deprivation. An estimated 50 million and 70 million Americans suffer from sleep disorders or sleep deprivation, according to the Institute of Medicine. Inadequate sleep is a risk factor for childhood and adult obesity, says Hu. Sleep-deprived people may be too tired to exercise, take in more calories, and may undergo hormones changes that control appetite. The consequences of the obesity epidemic are devastating. High blood pressure, diabetes, heart disease and stroke are not only killing millions of Americans annually, the obesity epidemic is also a humongous burden on the American healthcare system, making up $190 billion a year in weight-related medical bills.